I'm giving this presentation on behalf of Lena Perka, who is not able to come to Zug. The German arthroplasty EPRD shows clearly that the re-revision risk in total hip arthroplasty is high, and that this risk is even higher in infected cases. We asked ourselves the question whether a periprosthetic fracture is the revision reason, and that's a case where the operation should be executed on the patient as soon as possible after the patient enters the hospital, whether this comprises an increased burden on the re-revision risk or on the mortality of the patient. We analyzed the about 13,000 re-revision cases in the German registry. We grouped them dependent on the reason for the first revision, and we also analyzed the cases with and without periprosthetic joint infection separately. We looked at the time between admission and surgery and also did a Kaplan-Meier analysis for all of these reasons. The overall re-revision rate after an aseptic revision hip arthroplasty is about similar, independent of the reason what it is executed for. As soon as an infection is present, a periprosthetic fracture carries a much higher risk of re-revision, more than double as high, and it amounts to about 65% after 7 years. The mortality is similar for the two groups, as is the time spent between admission and surgery. So the re-revision risk for all the planned revisions, these are the revisions without revision for periprosthetic fracture, is not lower, despite there should be the possibility to optimize the patient, and one would expect lower numbers. The revisions for periprosthetic fracture with an infection have very high re-revision risks, and this brings us to the point that we say we should reconsider whether it's a good idea to operate on them immediately after they are admitted to the hospital, even so the infection diagnosis then is typically not completed. Thank you very much for your attention.